Hello everyone, and first, thanks for Professor Amar and the team in the committee from the Geospatial Health Symposium, and thanks for inviting me. This is a pre-recording video. My name is Dr. Ori Goods, and I'm an adjunct senior lecturer at the School of Population Health at the University of New South Wales, Sydney. And today I'm going to present, in fact, a project or a research project that is still in its early days. And this is actually led by also Dr. Sibylla Bentley from New South Wales Health and Mr. Pangang Gerg, also from New South Wales Health. And I'm going to present some our initial findings from this research, as well as some of the, geospatial techniques that have been applied throughout the project so far. So the title is Geospatial Analysis of Child Development Assessment Services in a Socially Vulnerable Region of Sydney, and in particular, we're focusing on western or southwestern part of Sydney. A bit of a background, so we focus on neurodevelopment disorders, NDD, and essentially in terms of background and rationale, they are actually on the rise. And understanding of the geographic distribution and access variables of child development services is crucial. Prolonged wait times for development assessment can significantly impact care and outcomes. So that essentially gave us a bit of motivation to apply some of the techniques that we applied in this study. So in terms of the aims, the study aims to geospatially analyze the profile and access to publicly funded child developmental assessment following the streamlining of clinical governance processes in a socially vulnerable region of Sydney. And in terms of the gap, essentially not much research in this field was done using geospatial analysis technique. And I think this is where we all pair together to see what can we do, how we can do better things beyond just looking on regular statistics, which I also report some of it now. So a little bit about the methods and the case study. So we extracted data for 2,354 patients from the Child Development Assessment Service, or CDAS, dataset over a 4-year period between 2018 and 2022, which is essentially also covering COVID-19 time. Socioeconomic indices for area, which is also known in Australia as CIFA, were obtained from the Australian Bureau of Statistics, or the ABS, as a short term. We employ descriptive statistics to analyze demographic data and various geospatial techniques to examine the relationship and factors affecting waiting list. And it's important to say that I was mostly leading the geospatial techniques and analysis so far. And as I said, it's an early day of the study, so I'm only going to present some of the early findings, and we'll be very keen maybe next year to report something more mature and substantial as we progress with this study over time. So I'll just start with a bit of a map. So this is a map of Australia. You can see New South Wales in yellow on the kind of bottom right, and you can see Sydney around here. And this is a bit of a magnifier or magnified area of Sydney, and you can see the different LGA. LGA stands for local government areas. We focus obviously a little bit towards the west and southwest part of Sydney. This is Sydney CBD around here, which is also where the Opera House, the famous one, and the harbour, and our area of study spans across all Sydney, but in particular, we had a lot of focus on what we think need more attention, and this is kind of the southwest, outer west areas, including also Parramatta. So that's a bit of a geographical context. Now, before I'm going into a series of maps that I've created for this presentation, I want to go through some of more descriptive statistics and results. So the median age of the children was about 51 years old, with 73% being males. Among the children, 64% came from culturally and linguistically diverse background, what we also call as CALD or CALD, and 10.1% had at least one social vulnerability factor in addition to CALD. Nearly half of the patients resided in the most disadvantaged suburbs, which we measured using the CIFA index. I'll see it in some of the maps in the next few slides. 1/3 of the children were diagnosed with global development delays, or what is also known as GDD, and 50% had autism spectrum disorders, which is now ASD, while the median wait time was around over 300 days, which is quite significant. 25% of children were assessed within 6 months, and CALD patients and children over 5 years of age had shorter waiting time, and you can see here it's respectively in terms of statistic significance. Most children with GDD were from the lowest 4 CIFA deciles and experienced longer wait times. So that is to say, we already identified some of these most disadvantaged areas also incurred quite significant waiting time. Approximately 42% of children were seen either within the same priority allocated at the time we had, or earlier we had priorities between 1 to 3. And children with ASD and or severe and profound GDD were prioritized for earlier assessment, as probably to be expected. So what I would like to do now in the next few minutes left on the presentation is to look at some of the map outputs that we've created through the study. Hopefully you can see the text properly. So the question is there any clustering of longer or shorter wait time according to CIFA scores, and in which suburb and or facility? So as we can see here, that there's kind of a bivariate layers, so bivariate map, in fact. So I guess the areas that are more shaded red or brown, they are more disadvantaged. And then also this, the other layer, which you can see as the size of the circles, is also where average waiting time is greater. So if you can see here, several of the suburbs have been selected, and they are actually colored by light blue, like Lorena, around this Ascroft, some areas around Campbelltown, as you can see here, and some areas around Bankstown. So just by really using quite simple analysis technique of analysis mapping that is derived from bivariate maps, we were able to straight away, not just looking on the descriptive statistics and the data that I reviewed earlier, is actually looking on the map and get a bit of geospatial sense, or geographic sense, and understanding which suburb actually needs to be prioritized, which suburb we should focus on. And obviously maps like that were very useful to then report back to New South Wales Health. The next question was, is there any clustering in age of the child wait times, country of birth according to CIFA indices? And again, the same practice was done there. And again, the areas where we selected, and you can see that bluish circles, these are the areas that we found to address these parameters, and we were able to actually focus on these areas using, again, bivariate map for the sake of that analysis. As you can see, the patterns are quite similar, and obviously not to be surprised. Other techniques that were used, again, as bivariate map, in this case, is just showing a bit of the legend and an output from RGS Pro, which was used in this case. The question that was addressed here is which suburbs are deprived and have long waiting time. So if you can see here the matrix of the colors and the legend. So we were looking on the areas where there's a high. Okay, so this color represents score index of CIFA. The shaded color, the I guess the more deprived, and then the shaded color here, the red more or the brownish, means the more time waiting averagely. So we're looking on a couple of these areas here. Use my pen maybe. So that was very, very useful output. And we've done that actually in, I'm only providing here one example, but in fact, we've done it for several different variables as well. Yeah, using this kind of mapping, this kind of technique to really help our decision makers from New South Wales Health to get better understanding in terms of the geographic context. Other obviously technique that were used, and again, it's just one example. We were using hotspot areas. Not to be surprised, we were looking on statistically significant southwest part of Sydney to be a hotspot, and the other areas a bit more of a cold spot. Some areas were insignificant statistically. We then were actually doing a couple of other things. We were looking on, and I haven't included in this presentation, that we're looking and asking the question of why we see some of these patterns. So we're looking on spatial regressions and trying to understand, and especially we use geographical weighted regression. And that's something I probably will be able to present once this model is more validated in maybe future presentation. But obviously, once we answer the where, the obvious question that comes next was why, and which patterns or which factors are essentially explaining this. We were also looking on different visualization and graph techniques, and we were asking questions such as, are there any clustering in ethnicity with CIFA indices? And we were looking on, I guess one axle was the ethnicity, where they're coming from or where they were born, and then the mean of calculated waiting time. We did see some pattern towards people coming from an Asian background, or either from Arab background or Vietnamese. So things that actually we need to take in attention and see why some of these groups are actually disadvantaged, and then look on method or practical ideas to actually address these issues. Other maps that have been created were which suburbs having low CIFA index and high waiting time. This is something that was shown earlier as well, but here's some of the areas that have been highlighted and selected. As you can see around here, the southwest part of Sydney was definitely the most dominant one, and we obviously pass this back to some of the decision makers in New South Wales Health. Other questions that were asked were such as, are there any clustering of ASG, GDD, or ASD diagnosis with CIFA facility? And we were looking on that, and we've seen a couple of LGAs, again, local government areas such as Bankstown, Liverpool, Ashcroft, and Abbotsbury, which all almost resided on southwest Sydney as more pronounced. So that kind of really validated some of the maps that we've seen as well. So we were looking on the maps, and then we were looking on the other data analysis, in this case, just using a very simple chart or figure to actually validate some of our results that we've seen through the GIS analysis. Other maps were focusing on Aboriginality. So the question was, are there any clustering of Aboriginality? And we were looking, because we might need to actually tackle some of the issues, these issues a bit differently and in a different context. We did find some of the suburbs which I mentioned even before, like Lorena, Claymore, where there's a bit higher rates of Aboriginal people or Torres Strait Islanders. So we might actually need to address some of the issues there in a different way. And that's obviously a contextual data and contextual information that is important to know. So to keep within time, some initial conclusion, as said, this is very much early days of this research, and I will be very happy to present more on that maybe next year. So this geospatial analysis approach sheds light on the profile, prioritization, and waitlist of children served by CDAS in southwestern Sydney, a region characterized by high social vulnerability. The findings provide guidance for benchmarking targets and underscore the continued need to prioritize children from socioeconomically disadvantaged areas or background. Public investment in child development assessment service is imperative to enhance access to assessment for these children. Further geospatial analysis at the suburban level are required to formulate targeted strategies for improving service accessibility. And we're already doing some more advanced analysis, which I'm unable to share yet in this form. And I'm happy to do this at a later stage. So last slides, what's next? We're going to continue our more research and revised analysis. We're working on several spatial regressions technique to understand and address some of the why questions. We're starting to work on a report for that will go into New South Wales Health, and that will then lead to an academic publication, which we'll consider to use maybe your journal, Amar, to publish. I think it will be very useful and will be within good settings. And obviously, we are looking into briefing back some of the decision makers in New South Wales Health, which also provides some support and resources to this research. And with that, that comes to a conclusion. If you do want to contact with me, my email is o.goods@unisw.edu.au. And again, I'm thank Amar and the committee for inviting me for this online symposium. And I hope you enjoy the rest of the conference of the event. And I'll try to maybe jump to a few of the session and try to learn myself. Thank you very much.